They're COVID patients that are waiting?
We just don't have enough space.
We don't have enough space.
In the very first days of the pandemic, Holy Name Medical Center in Teaneck, New Jersey, was hit hard.
Are there monitors?
There's no monitors.
And resources.
When it came, when it finally was here, and all of us were, it's here.
I can barely staff the ER.
And it came very furiously.
Dr. Benjamin de la Rosa worked in the COVID unit every day. By April, they were seeing a new patient about every 10 minutes, as many as 250 hospitalized on a given day.
And what kind of people were walking through your door?
Different than what we have heard, where it was older people with a lot of pre-existing conditions. These were young people.
Ed Pierce, a healthy 49-year-old father of 3, a workaholic husband who made a name for himself as the set designer for Broadway shows, including Wicked. But all of Broadway would go dark on March 12th, and a week later, Ed was fighting for his life. When he contracted the virus, he'd been taking a medicine for a skin condition that suppressed his immune system. That might explain why he deteriorated so quickly. 4 days after being hospitalized, doctors had to hook him up to a ventilator and induce a coma.
What are the chances when you put someone on a ventilator with COVID that they're going to come off that ventilator?
Every time I look at statistics, it's very a grim prognosis.
Most people don't come off.
Most people don't make it.
Did you even let yourself think about that possibility?
I went there once or twice, and I couldn't do it. I had to stay positive for the kids.
Ed's wife, PIXIE, and their 3 teenage children weren't allowed anywhere near him.
It's one thing when you have somebody that you love who's sick, and you can go sit by their bed, but I couldn't even hold his hand. I've kind of made a schedule for myself and the kids, and I know somewhere in there, my doctor phone call will come.
And then, on one special day, it did.
Look at that, who's that?
Let's see him. Let's see him.
Ed had survived being on a ventilator for an unbelievable 36 days.
First time you FaceTimed with PIXIE. Do you remember that?
I remember it because there's photos of it.
You tell him he's graduating today. He's moving down to the other floor. Yeah.
When I woke up, I felt like I was in a set because it literally was like how we build sets. There was like plastic sheeting and strings of lights and electric wiring run, everything stapled together. And
you must have been confused.
I had no idea what was going on.
Why do you think you're here?
I think because I'm a fighter. In my business, no matter what, you get to opening night, and I have more shows to do.
On the day of Ed's discharge, the hospital played Defying Gravity, the signature song from Wicked that's about beating the odds.
I heard that song hundreds of times. It's never had the impact that it had that day.
I was so grateful. I fought really, really hard for him. Really hard.
No one knows for certain if any of the treatments tried on Ed had worked or if his body somehow outlasted the virus's attack. But as the growing number of COVID survivors can now tell us, their struggles didn't end at the hospital. The impact of COVID is something researchers are just beginning to learn more about.
I felt very tired, very weak. It was challenging not to be able to move my left side. I realized rather quickly that I was just at the beginning of a whole new journey.
It was startling at first. Total muscle loss. Walking across a room could wind him.
What long-term effects could Ed have because of COVID?
We don't know because it's such a new illness. What we are learning, though, is that COVID can affect any part of the body.
While scientists desperately try to understand how the symptoms of COVID persist or reemerge in recovered patients, there was no time to wait for answers at Holy Name.
Temperature is normal.
So the hospital created PACER, Post-Acute COVID Exercise Rehabilitation, an outpatient program tailored for those physical post-COVID ailments like pain and immobility, lingering fatigue and weakness. Jules O'Hagan is his physical therapist in the program.
He was almost completely flaccid on his left arm and leg. He couldn't move his arm at all. So they had theorized that he had a stroke. They did all the scans. He didn't have a stroke.
Is he still weaker on the left side?
He is.
Some PACER patients have been treated through virtual sessions, but Ed's been going to the center 3 times a week for nearly 2 months now.
Ed's kind of a guinea pig with everything.
Ed has also had to learn to expect less from his body.
That's not working well today.
His shortness of breath steadily improved. Ed's put in the hard work, but he's also one of the lucky ones when it comes to COVID.
Other people that have had COVID have a lot of disabling symptoms, weeks to months after they recover. There are people, for example, that I am taking care of. They still have palpitations, they feel dizzy, they feel short of breath. Others have fever.
Lung scarring, cardiovascular, and neurological damage have also been diagnosed post-infection. The CDC recently reported that 1/3 of COVID patients suffer persistent symptoms at least 2 to 3 weeks after recovery. A new study by Indiana University based on 1,500 COVID survivors who are part of a Facebook group identified 98 long-term effects, including blurry vision, night sweats, and hair loss.
We're looking to learn who is more predisposed to having long-lasting symptoms and who is predisposed to getting well quickly.
Trying to figure out what determines that.
Exactly.
No, it's mine.
Though Ed's insurance paid for all his medical bills, he is out of work at the moment. He and his family are living off savings. When theater doors reopen, he'll be ready for his next challenge, staging the national tour of To Kill a Mockingbird.
You've never seen it like
I have never seen it with the lights off.
Is it sad?
It's devastating.
Most industry observers think New York theaters won't open until at least the beginning of 2021. What it might look and feel like is anyone's guess at this point, but if Broadway shares any of Ed's determination, we can count on an amazing comeback.
Would shows reopening be part of your recovery?
Absolutely. That will be the end of another chapter in this story when we can get back to it, get our lives back on stage.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.